Well, while the New South Wales Parliament is debating the conscience matter of abortion, as we've just discussed, a similar life and death debate is underway in Western Australia, and it's dividing the community and the Parliament. The issue in the West is, of course, euthanasia, with concerns voiced by doctors and others that the government is attempting to rush through laws to bring in assisted dying. The evidence for this claim comes from the fact that the ministerial expert panel on this legislation only reported back to the government in July, giving the government only a handful of weeks to draft the legislation. And it looks like it's different than Victoria. It doesn't just rely on a terminal illness. But this is not the only part of the opposition to the proposed laws in WA. According to official statistics, WA has the lowest level of palliative care specialists per capita in Australia. It has the fewest publicly funded palliative care beds, and only 1 in 3 people have access to quality palliative care. Joining me now to go through their concerns around what this bill could mean for terminally ill patients and others in the state of WA, and also the issue of palliative care support, is Chairman of the WA Palliative Medicine Specialist Group, Dr Anil Tandon, and former President of the Australian Medical Association, Dr Rosanna Capolingua. Doctors, thank you very much for your time tonight. I'll start, if I can, first with you, Dr Anil. I'm interested in the issue of this legislation. Let's start at the process end in terms of timing. I went through then. July expert committee reports. It's now early August. The legislation's already done and dusted. It's into the Parliament, we're told, tomorrow. You'll clarify me that in a moment. But the worries people have is this extends beyond terminal illness. Is that correct?
Absolutely, and I think that what we're seeing at the moment is that because there hasn't been the time and the process given to this discussion, there are lapses in the security, the safeguards that are being put forward to ensure just only the right people are being considered for this possible legislation. Before that, however, we really need to look at how we can actually get palliative care right in Western Australia. Like you said at the beginning, Peter, palliative care actually in Western Australia is not available for all. So to give your listeners an example of what that might actually mean, in WA we've got only the equivalent of 15 palliative care specialists in the state. And so the actual recommendations for a state like Western Australia would be that we should have somewhere between 30 to 60 palliative care specialists in the state. So at the moment, we're in at a point in time where it's just not even available at the moment for Western Australians at the end of their life to get the care that they need.
Okay, let's just not assume everyone understands. They know the term palliative care, but just take us through what palliative care means in practical terms.
So palliative care is an approach that is provided to people who have an illness that is going to cause them to die. That approach is based on pain management, other symptoms, walking alongside them, and most importantly, not abandoning them. And what we feel is that legalising euthanasia would actually be abandoning patients who actually need the care that they're not actually getting.
I want to bring in Dr Capolingua. Dr Capolingua, you're formerly President of the AMA. In Victoria, when they debated the euthanasia legislation, there was a lot of opposition from doctors who felt this compromised the oath that they take, it compromised issues of their own conscience, and they felt there were other things like palliative care that society needed to fund properly in the first instance before we went down this path. How do doctors in the West feel about this issue?
Well, for us, in reality, our job has always been to look after our patients, care for them and give them quality of life at all times. And death has not actually been a treatment option, and that's what it is now. You know, death is a real treatment option for patients. So, of course, there is grave concerns. The argument has been around people having the right to choose, but I would tell you that West Australians haven't had the ability to experience choice in the first instance. As Anil has described, access to expert palliative care is very limited. We hear a lot of stories true, genuine, heartbreaking stories of pain and suffering for patients and their families who are on that journey with them because they have been abandoned by the government who hasn't funded them with appropriate expert palliative care to relieve that pain and suffering. Euthanasia, all that does is in fact take your loved ones away from you sooner. It steals time away from you both. And for those that are sick and unwell and dying and frail and vulnerable, they feel that they are a burden. And in fact, it is a relief for them and their families to choose suicide. And I think that is a very poor situation for us when we haven't been given the real choices of expert palliative care.
Okay, well, you're not just a doctor, you're someone who's been involved in the politics of the medical sector for some time. I have to say, I'm no doctor, but I've been involved in politics. It would seem to me, and I might be cynical, that part of the defunding or not sufficiently funding of palliative care has been for the broader goal of getting up euthanasia. So enough people know someone that's close to them that have suffered with a terminal illness or have died what's considered a bad death have been part of the impetus for euthanasia. Is there a relationship, do you think, in the way we have not funded palliative care and the fight we have now, with particularly the left, to see euthanasia laws brought in right around the country?
I don't think that we have sinister intent here. I would not like to believe that. But I think one is definitely a consequence of the other. Indeed, if you have this horrible experience and you hear of those stories, far more than you hear of the ones where a loved one has been tended for and there's been a shared experience of family and the dying person that actually has been a good one, a holistic one, we hear more of the pain and suffering, and that has been a result of the lack of access to palliative care. And remember, WA is a big state, so in rural communities it's even worse. The most vulnerable are most at risk of having to choose assisted suicide because they feel that there is no other option. So yes, we've got euthanasia on the table because we've done the other so poorly. We have actually robbed our people of the ability to experience death in a way that is not the negative burden that is being described.
Dr Anil...
And death is always sad.
It is, and unfortunately it's one of those things that we all will experience at a time perhaps where we see it coming at us, and other times it will happen and we'll be gone before we realise what's occurred. Dr Anil, I'm interested in terms of the consultation that you've had with the government in the preparation of this legislation. It does strike me as very hasty for an expert panel to report in July and then legislation to be on its way into the Parliament. You've got to worry about the drafting. But more important than just the drafting, you've got to worry about the level of consultation between experts like you and lawmakers. How much consultation have you been involved with or your organisation?
So Malcolm McCusker, he made a number of recommendations to government, and there were recommendations that were based around three areas: euthanasia, assisted dying. There was also recommendations about palliative care, and thirdly around advanced care planning. Now it's interesting that we've already had the legislation tabled today, but we actually as yet haven't had any formal consultation with government. That's actually scheduled later on this month. So it seems that we're putting one option well ahead of actually treatment options for patients.
Sorry to interrupt you. Can I just jump in there? But if you're not going to talk to government for a number of weeks, they're already signalling that's about the time that they'll be voting on this legislation. How does that work?
Correct.
How does that work?
I think that's a very good question, and I wish I knew the answer. What I would like to say, though, Peter, is that this timing, and I think that the month that you mentioned of July is relevant because just a few weeks before, in June, as we all know, assisted dying was made legal in the state of Victoria. What we would like to suggest to government is why can't we actually learn from the Victorian experience? And I think that in medicine, learning from the experience of our colleagues is really very important. And so we need to see how that legislation works. That's particularly important because overseas, in countries where euthanasia is legal, we know for a fact that the safeguards do not work. So in Victoria, they've tried to adjust the legislation to provide what in their view is a safe and compassionate option. Well, let's test it. Let's see and learn from their experience before we actually rush into it here in Western Australia.
Well, Rosanna, also too, how about we take some of these big issues that are being debated in New South Wales and obviously just not so long ago in Victoria and now WA, how about we actually take them to an election? Because in all of these circumstances, the people who will live and die under these laws are not given any say at the ballot box.
Well, I think that this particular move in Western Australia was an election promise by then Labor opposition, now government, and the push is really to get it through and deliver it before the May budget next year, I guess, so that then they're in election mode for the year, the following year, and perhaps the influences are not something they want to deal with. I guess this is an election promise they want to keep, but I think it's an election promise that really needs to be looked at very carefully and very slowly and with a great deal of reflection. And I think that the bill that was introduced today in great haste, I mean, I think it was in caucus yesterday, to Cabinet yesterday morning, caucus in the afternoon. The opposition got it this morning. It's being tabled today. Very rapidly done. I think they might have been drafting it in the background for a while beforehand because the intent is to get this through quickly. Under a lot of emotion, you know, we've had Andrew Denton in town overnight. It is really something, it's a life and death issue. It changes the parameters for medical care in our state. It certainly is a way of saving money. I hate to say it. People do feel that they are a burden on the health system. They will perhaps be even feel coerced into choosing death. There's a whole number of factors around the very vulnerable person who is terminally ill or will die in a probable or likely manner, I think is what the bill sort of describes to a degree. It's an extremely vulnerable situation to be in, and there is no need for us to rush. And the more one looks at the bill, or we get legal experts to look at the bill, the more it raises concerns about protections around capacity, coercion. The doctors involved are not medical specialists in the area of illness that that patient is suffering from. I wish we could just focus on making sure everyone gets access to expert palliative care right across the country, that it is equitably delivered, and that patients don't lose trust in the medical profession and healthcare.
Dr Rosanna Cabalingua and Dr Anil Tandon, thank you very much for your time tonight. It's a difficult subject, but I think we've got to talk about difficult subjects. Thank you.